points that are important to the sport that we do. So Bernardo is going to talk today about preventing injuries and the difference between recreative athletes and a competitor. It's more or less the thing?
Yeah.
That's more or less the thing. He's a kick-ass master, so he knows what he's talking about. Yes, you are, buddy. Don't be modest.
Okay. Hi to everyone. For those who don't know me, my name is Bernardo. I'm a medical doctor specialized in sports medicine. I'm a CrossFit level 1 trainer, and I'm a wannabe athlete. Not an athlete, actually. This is supposed to be a completely non-formal speech, okay? Or a talk, whatever you want to call it. So feel free to interrupt me or disagree or say anything that I'm not saying. Anything. The title, Preventing Injuries in CrossFit, it's so relevant because we know injuries make part of our sports, as to many sports. But we could talk like for 1,000 hours and agree with everything, and next month some of us will get injured for sure. So injuries do make part of our sport, along with other sports, of course. The thing is, when we start searching the publications, scientific papers done regarding the injuries in CrossFit, we see that the rates of injuries are quite similar to those happening in gymnastics or weightlifting, which is not a surprise, of course. The rates are much less than contact sports such as even basketball or rugby, but they do happen. Okay. One data that is interesting is that the rate of injuries in women is much less than men, and that makes us think in the first question, why is that? Because we know, generally speaking, that women have thinner ligaments, thinner tendons, the muscle capacity is usually less strong, even the structural body composition is not so strong, and that makes us think, why do women have less injuries rates, of course, than men? And the reason is women usually take less risks. Okay? So that comes up to the first question that we should address in the first day that we go into a CrossFit box. What risks are we willing to take in order to achieve our goals in CrossFit? Okay? And even in a more simple way, what are our goals in CrossFit? Because if we are here just to have fun and get rid of the stress, daily stress of the job, or familiar issues, I don't know, then this is the place to be, actually. That's a very legit way to be here. That's a very honest goal. But if you're here to be a competitive athlete, I don't know, you want to compete in a local event, you want to be at the regional level, then you have to acknowledge that there are some risks. And the risk, one of them, is actually the injuries. And that doesn't only apply to CrossFit. Okay, we know that most of the sports, most top athletes are dealing every day with some kind of injury, with some kind of pain, with some kind of rehabilitation. So we really have to think for ourselves, how much are you willing to risk? Okay. To understand some of the mechanics of the injuries, we have to first understand some of the mechanics of our own anatomy, our own physiology. And when we again search the data, we see that most injuries in CrossFit are first the shoulder, then the lumbar spine, and then the knees. Okay? So let's address, for example, the shoulders. It's quite easy to understand why the shoulders are some of the most affected injuries in CrossFit. Actually, number one. And mainly because of two reasons. First, the range of motion of the shoulder. If we only see the structural bones and the joint of the shoulder, it's a quite complicated and sensitive on the other side a kind of a socket, a cup, where the ball inserts. Okay? So, in order to do all these kinds of motions that our arm is able to do, the joint is really unstable. And what stabilizes this joint is actually a compound of muscles, a group of muscles that maintain and allow the range of motion of the shoulder. Of course, the more range of motion, the more unstable, usually. Okay? The second thing is one joint that is almost similar to the shoulder is the hip joint. There's also a socket, okay, in your hip, and there is also like a ball, okay, and it articulates exactly the same, not with as much range of motion as the shoulder, but basically the mechanics are similar. The thing is, not only the range of motion is not that big, but we are training this joint almost since we were born, okay? Especially when we start walking, we are always training this joint. The structural bones, the structural muscles that keep stabilize the joint, we are training it all day long. Walking, jumping, and when we reach 30, we turn ourselves and say, oh, let's start doing CrossFit. And then we hang ourselves in bars. And then we pull ups. And then we put some vests on. And then we do handstand push-ups. And we start walking. And this is not, well, it may look natural, but it isn't. Okay? So please give some time for the joint to build the structural muscles and ligaments and tendons in order to avoid these injuries. Okay? So that's important to understand, and this is the two main reasons why the shoulders are the most affected injuries in CrossFit. Okay? One other thing that helps us to understand a bit more about injuries, we all have our ankle sprains, our torn ligaments, more or less. This is like an overstretched joint or a non-natural movement that your ligaments and your tendons are not capable of. So they torn a bit. Okay, they get small ruptures in the fibers. And what happens is if we illustrate our muscles and our tendons. Tendons are basically the parts of the muscles that attach to the bones. Okay, and if we think this as a muscle unit, and the muscles do just one thing: they flex, they contract, and they get parts of the bones closer to each other. So that's basically what the muscle does. So for some reason, this is the work of your already strong muscles. Okay, you can bench press 100 kgs. Okay, let's imagine, and you can flex all of this with your strong muscle. But for some reason, because of wear and tear, because of some non-normal movement, because you didn't warm up properly, for some reason, this band gets a small rupture. Okay, some of the fibers are lost. Okay, and then you have an injury. Okay, so all of a sudden, this band doesn't look like this anymore. There's a small rupture. We are not talking about total rupture. Okay, it's not tearing apart. It's just a small rupture. What happens is it hurts. It hurts a lot because of an inflammation. But the inflammation, it's natural. It's physiological. You really need the inflammation because the inflammation is basically the cell components, okay, that go into the rupture part in order to rebuild what was ruptured. Okay, this is the anatomy and the physiology of any injury. Of course, too much inflammation is bad for you. That's why we advise to put some ibuprofen, some ice, some whatever. Okay, but some inflammation is actually needed. But what happens is, in the acute phase, you give some rest in order for the fibers to rebuild again. But like the skin, what happens is when the rupture heals, the fibers get actually shorter. And because you rest, and you give like, I don't know, imagine 3 weeks of rest to this tendon, it not only gets shorter, so it gets thinner, okay? But after, I don't know, 3 months, 3 weeks, or 1 month, you're pain-free, because there is no more inflammation, the nerves are no longer irritated, okay? And you're walking free of pain. But you don't know that your tendon, your muscle fibers, look like this. They don't look like that anymore. Okay? But in your mind, you're a strong motherfucker. Huh? So you know you can bench press 100 kgs. And you go there and you want to bench press again 100 kgs. And what happens is that you're going to bench press 100 kgs with these tendons, with these muscle fibers. And the re-injury happens. Okay? That's why every time that we heard, like, first time I got an ankle sprain, every time I got, again, this ankle sprain. Because we didn't do the proper rehabilitation. Okay? This is the thing. We have to rebuild two things. Because this not only got thinner, but it got shorter. So the range of motion was lost, and the strength was lost. Okay? So we have to look again for the long, for the big, thick, and flexible muscle fiber. Okay? This is something that we usually stress in sports medicine in order for the proper rehabilitation. Because you are just looking for the pain-free and go and play. Okay? But the proper rehabilitation can maintain your form like 100%, not forever, but at least most of it. Okay. Have any questions? Let me know. Okay.
How long would that take?
Huh? It all depends. It all depends. It all depends. How big was the rupture? How old are you? Okay. If you're doing the proper rehabilitation or not. And when I talk about rehabilitation, I don't talk about total rest. Okay. There are very, very few situations when you have to be totally immobilized. Okay. Very few. Of course, if you talk about fractures, the bone has to be stable in order to heal, okay? But all the rest will benefit with some movement, okay? It's like rest. When you do active rest, it's better than just lie down, okay? When I say these things, I talk to you and I talk against my colleagues, my general doctors. I'm sure that this happened to you somewhere in time. If you go to a doctor, a general physician, family doctor, whatever, and you say, hey doctor, after I run 20 miles, my knee starts flaking or starts, why are you running 20 miles? What? That's the basic question, that's the basic answer. If you're saying that you're deadlifting 200 kilos, 99% of the doctors will tell you, why the fuck do you do that? Okay? So, the thing is that you have to answer them. Hey doc, that's what I do, that's who I am. So, that's why I'm a lean, fit guy, and you're a lazy, fat guy. And if you don't understand that, either you give me my money back or I go to any other specialist. But listen, I know doctors are not easy to reach. They're expensive. There's not much formation in sports medicine. Not many understand that, not that we need that 200 kilos, but they understand that that's something that you do on a daily basis. But try to reach them, okay? Because that makes all the difference. Makes all the difference. And if we say they're expensive, in part that's true. But if you're spending like 800 euros on a cell phone, and if you don't spend 100 euros on your health, I mean, priorities are a bit, not that good. So, to wrap it up, what I'm saying is, the most important thing is really to reflect what are your goals in CrossFit, okay? Because if you are just here for becoming fit, it's quite easy. You just have to fight with your laziness, and you may choose your exercises even. Okay, because let's make it very simple. To do pull-ups, should you do strict pull-ups? Should you do butterfly keeping? It's simple. The answer is very simple, and you answer it with your goals in CrossFit. If you're just here to work on your latissimus dorsi, your biceps, your general fitness, hey, the strict is the answer for you. You are pain-free, you don't need a big range of motion, but if you want to smash down your time in frame, no way you can do less than 3 minutes in strict pull-ups. So that's my advice. It may look a bit conservative, but we're talking about injury prevention. I know I'm not the best person to do it. I'm the best person to say, but that's basically what you should advise in your bosses, in your friends. Don't take risks that you're not willing to take the injury resulting from those risks. Okay? Thank you very much. If you have any questions, anything to add, just feel free. Huh?
Come on, guys, take a shot.
It makes sense, no? The things.
So for training like 5 times a week, so basically CrossFit says you have to take 2 days rest, but compare how it works to actually rest smartly and still be active.
Okay, so that's a good question. The rest, it's not immobilization. Okay, let's make it clear. The rest, it's really lower down the intensity of the work. The rest may be even like swimming or doing some jogging, because the active recovery shows us that the recovery doing some exercise, some aerobic exercise, is much better than just immobilizing. Of course, there are a couple of well, you may call it tricks